Hello everyone, and thank you so much for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about the topic of brow lifts with Dr. McIntyre Bridges from Bridges to Beauty, and we want to encourage you to ask the questions on your mind about brow lifts. If you're watching online on KTBS.com, you can submit your question on the right hand of the screen there, or if you're watching on our digital channel 3.3, we want you to just give us a call. The number is right there on the bottom of your screen. It is 219-4569. We will be taking your questions live through 12:30. Dr. Bridges, thanks so much for being here today.
Oh, Carly, enjoy it.
So tell us about brow lifts. Just if people haven't even heard of it before, kind of explain it to us.
Well, it's another component of a facelift. It would be included in what's called a full facelift or by itself. But essentially the goal is to make someone look younger or less angry appearing by raising their eyebrows back up to where they used to be when, let's say, they were 16 years old or thereabouts. It's not there to make them look like they have their deer in a headlight, but still, that's what gives them the best younger look. In women, you want to raise it, but you want to raise it a little more laterally because, you know, as men's eyebrows can go straight across and things, women's needs a little lift laterally to give you a little more what's called that white show. It's a younger look.
Yeah, the arched eyebrows are kind of what's in style and more womanly look for you. So are there different techniques when it comes to brow lifts?
Yeah, there's three basic techniques, and again, as we mentioned earlier, there's not one that's perfect for everybody. There's an endoscopic technique where you're basically making incisions in the scalp, small incisions. You're undermining the forehead region down to the eyebrows, and then you're actually just scooting the scalp back to lift it up. I think that's better in younger people than it is in more mature clients. The other one is coronal brow lift, where you go. Typically, it's in front of the hairline. Sometimes, if they have a short or a shorter forehead, you can do it in the hair, but most people don't. You're doing the same thing. You're elevating that tissue all the way down to the eyebrows. You're taking out some skin and trying to bring the hairline forward as well as shorten the forehead. And the third one, and it generally is more applicable to men, is where you'll make a incision in a current wrinkle or line, and you're taking out a little swatch of skin, and then you're bringing it up to get the heaviness of their eyebrows better.
So in that last one you're talking about, the procedure for men, you actually, when men have creases in their forehead, you literally go in the crease?
Yes, that's where the incision will end up. The nice thing about creases in men and things is that, you know, you can always improve them even by, you know, doing that operation. You want a line because you just don't want to make a line in a forehead that doesn't have a crease.
I can imagine that wouldn't look right.
Yeah, that would look real obvious. You want to put it in a natural, free-flowing incision that's presently there. It'll actually improve that little line there. But the only way in men, in the majority of men, where you can get the eyebrows up to the appropriate level is to do that. Men have such receding hairlines, it's difficult to find someone where you can make an incision along the hairline and undermine enough to even bring it up. Most of the flexibility in the forehead is really here. Okay, so you can't just be pulling up here in men and expect this to move.
When women come in and you are talking with them about what a brow procedure entails, do they know how they want it done, the endoscopic or the coronal, or how do you really decide with them what is best for them?
Well, I'll help them make that decision. Like, see, if a woman has a fairly long forehead and you do an endoscopic, you're just going to make that forehead even longer. I mean, it'll look like more of a male pattern, you know, as far as the length of that forehead. And so, you know, if they have that, they want to do an endoscopic, you know, I'll tell them the advantages and disadvantages of doing it that way. And if they're willing to accept the fact that they'll have a longer forehead, then we can do it that way. Some people have so much redundant skin down here that it still wouldn't be a very good procedure to use. And so the coronal is probably, I'm doing 50% coronal, then maybe 40% of the endoscopic, and then 10% with the men. as far as the incisions across the forehead.
What scars are people left with in these different types of procedures?
If for the endoscopic, there's like 3 different little scars, little small ones, and they're in a more longitudinal type of pattern.
Oh, explain that in layman's terms.
Oh, right, so it goes back and forth. this
Okay,
way.
gotcha.
Okay. Versus more of a horizontal. And so they're just having incision here, incision here, incision here. You have to have access with the endoscopic because you're not opening things up to see. You're using a little endoscopic camera, okay, to see where you are, and you want to elevate things, and you want to zap little blood vessels that start to bleed. It's tedious, but it gets the job done.
And so you would have scars, but they would be in your hair,
They'd
right?
be in the hair,
Okay,
yes.
so
yeah.
they're really not noticeable.
Correct. Okay. If a woman comes in and her hairline is, let's say, 2 inches, 2.5 inches, she has a very low hairline, then you could put an incision in the hairline, okay, for a coronal, because you'd be taking up skin and you're making their forehead longer, but it's not excessively longer. For women who have a longer forehead, you want to make an incision really at the hairline. And again, the incision site there and the scar there is very, very thin. It's not very noticeable. Most people have enough hair there that it covers it up. But you don't want, I think, to make the forehead in a woman excessively long.
So just with that one type of procedure, it will change how big your forehead is.
Yes.
Do people ever think they look a lot different? I know that that may change the look of your face a little bit, how big or how small your forehead is. Mm-hmm. Has that ever been an issue for people, or is that a concern?
Well, I think it would be a concern if you chose the wrong operation. Again, the longer a woman's forehead is, the more male pattern it will become. I mean, it looks that way. Typically, when you do the coronal, if someone has a longer forehead, you're actually trying to bring the scalp forward as well as lift, the forehead region by taking out skin in the appropriate direction. That works out the best for them. I think that gives them the longest lift because you have the little muscular areas in the scalp that's always kind of pulling back a little bit. It doesn't make them look like they're deer in the headlight. And when you talk about that arch, the arch should be more in that lateral third, okay, versus straight up, which again, that's the more surprised look.
How long do these procedures take?
Typically, it takes about 2 hours. Okay, sometimes a little longer, sometimes a little shorter, depending upon what you find, and how, really the shape of their skull and the bones around their eyes are. The ones that have, what are called bony prominences, you have to do a little bit more careful dissection. You have to get over that bony prominences actually into the upper portion of the orbital rim. You want to get as much slack out as you can.
Are you put completely under with anesthesia for these procedures?
In most of the cases, yeah. And some of them we can do it under local sedation. Men, I'd rather have them asleep. They just do better.
What does that mean?
Well, if a man starts to move and things, and I don't care how much they're strapped down and things, it becomes problematic, And whereas women, they get strapped down, they'll move a little bit, but men tend to have more gross movements.
Right. Okay, that makes sense. What level of pain can people expect from this type of procedure? Right after and maybe lingering? Okay.
As far as the pain goes, you can almost expect a headache for that first 24 hours. I mean, it's controlled with the pain medications, but that's one of the things because the nerves are on stretch and they really don't take a joke. Once it goes through that little swelling phase, then it becomes just a mild kind of dull soreness. The scalp can be numb for a while because the nerves that go to the 2/3 of the scalp come from that direction. And when you're making a decision, I'm trying real carefully not to injure those. Some people will actually just cut them, but I think preserving them is a better long-term value.
Does the level of pain change between procedures? You said there's 3 different procedures. Is there one that's more painful or less painful that people say?
I think they're about the same. Maybe the endoscopic is less. For the men, going incision across in a formed line is probably not that bad. I mean, they're probably not going to get a headache or anything.
How much bruising can people expect with this type of procedure? You know, I mean, I've seen people when they get a rhinoplasty or a nose job and their faces are significantly bruised from that particular procedure. Can you expect bruising to linger from this procedure?
Not so much in the forehead region, but around the lower eye.
Why is that? You would think you're doing things above the eye, but why would the blood come down here?
Yeah, I mean, it's you observe that probably in, I think it's 80% of people or more. What happens is, let's say that you elevate these regions, sure, you're going to get a little bleeding, but you're drying it up. There's going to be some residual bruising. And as bruises go away and break down, things, they become more liquid, and they tend to kind of flow down along, fascial planes. And that's where, underneath the eye will be swollen a little bit, just because when your body's trying to get rid of a bruise, it brings in more water to do that. And so it's really important afterwards to keep your head elevated, I think, for a couple of weeks.
So no laying down when you sleep even?
Plenty of pillows. If you have a recliner, it's probably better to sleep in that, especially the first 3 or 4 days.
To help you recover better?
Yeah, and for the swelling. 2 reasons. I mean, it's like if you twist your ankle, you don't put it on the floor that night, or it's going to be twice as big. So the same thing with any other type of trauma, which that's what all surgeries are. You want to keep it elevated to minimize the amount of swelling. Secondly, just like, you twist your ankle, if you put it on the floor, it's going to throb like all get out. And the same thing with, the head. If you think you had a headache after the surgery, if you put the head down, things you really have a headache.
What type of recovery time can people expect as far as when the pain goes away and then when they will look normal?
Actually, a couple of weeks besides that bruising, they'll look normal. I do overcorrect at the time of the operation just because I think as it swells, it tends to kind of stretch out anything I've done, and I don't want it to. I want it to be a certain way in 2 or 3 weeks versus perfect at the time of the operation. I think perfect at the time of the operation, you're not going to have the results that you really want. So I always overcorrect in most of the things that I do.
What does that mean specifically?
Well, the end result, the brow should be up in a good, youthful position. At the time of the operation, when I'm finished, it's higher than that. Mm-hmm. Because I know it's going to come down. Okay.
Because there's swelling and things?
Absolutely. Any swelling tends to kind of soften tissues, it stretches things out, and so I think it's naturally going to come down some. The other thing I do for brow lift is I'll take Botox and I'll heavily, this is before the operation, heavily knock out all these muscles here, during that period of time. So I have 3 to 4 months where this is really kind of quiet. The reason, again, is those muscles tend to kind of pull things down in the first place. I mean, that's how your brows get there. It's not a gravity issue. It's when we squint our eyes or close our eyes or frown and things, these are constantly pulling against the forehead, and so it naturally just drifts down. During the healing phase, I don't want that. Because basically those tissues they're a little more tender. They'll have a greater ability to kind of stretch out than basically normal tissue work. So that's a couple of preventative things that I do prior to a forehead lift, because it all makes sense to me. It's a good rationale. It's the right thing to do.
Talked a little bit about recovery time, but say someone gets this procedure on a Friday. How soon until they could realistically return to work?
If we don't have a bunch of bruising, a week. And even if they have a small amount of bruising, that's easy to cover up. But in terms of the soreness, the discomfort, it's really about a week.
Let's talk about specifically what this procedure addresses or fixes. Is it wrinkles? Is it sagging skin? Is it what specifically is it? What can someone expect to improve?
Well, as we get older, certain features make us look older. As the brow comes down and crowds the upper eyelid, that's an older look. As your brow should be at or a little bit above the bony rim that you feel above your eye. That's a more youthful look. And so you're correcting those features primarily of crowding the upper eyelid and having that lower brow looks older too, or makes people look mean, or makes people look like they're worried about something. And that's what you're correcting, because young people don't have that.
What about people who are afraid? You do see facelift horror stories. One in particular that comes to mind, who has admitted that he went to a bad guy, is Bruce Jenner, who's on that Kardashian show now. You can just tell that something's up with his face. What about people who are afraid of maybe that super alert or deer in the headlights look?
Yeah, you don't, like you overcorrect a certain amount. You just don't go overboard with it. I mean, yeah, Bruce, poor fellow. I mean, how do you correct something like that? I mean, maybe over time it's going to come down, but he just looks like he's been in a wind tunnel or one of those centrifuge things that NASA uses. I mean, he's just so plastered out.
You do know, speaking of that and overcorrecting and things, is this the type of procedure, where you get a breast augmentation? You put in a bigger implant, maybe you decide you don't like it, you can get them removed and put in a smaller one, or vice versa.
Right.
Is this the type of procedure that is, you can't go back and do it again? Once it's done, or can, say you don't like it, could you do something else?
I've never really run across that. With the breast, you'll see it on occasion, and the most common one is, the wish we wanted it larger. But on the forehead, I mean, you can expect things to kind of come down some. So it never. Let's say that you had the deer in the headlight look. I don't know how Bruce's stay up so high, but that's going to come down. That's going to come down just because muscle movement around the eye, a little bit of gravity thrown in there. But I really haven't had that to be an issue.
That's good. What age do most people want to get this done at, or what age do you think people may want to consider this? Because you don't want to get it done too young. Yeah,
for most of them, when I'm doing the coronals and stuff, the age group is from 45 up to 65, and because they have longer foreheads, you have to work harder to get the lateral brows up. 30 is the youngest as far as like the endoscopic, and if they have just a little bit that they need to come up and things, in other words, they're well preserved even into their 40s, then endoscopic will work for those. Again, it's real kind of individualized, but that's kind of the breakdown from a bimodal standpoint of view, that endoscopics are a younger group than those who require coronal. And for men, it's going to be in there. They can be from early 40s up to 70s and things. It all depends on when they develop that real heavy brow.
Is there anybody who is a bad candidate for a brow lift?
Typically, those people that have medical issues, they would be a bad candidate, especially someone that's on a blood thinner or something,
okay,
and they couldn't come off. They would be a bad candidate because it's not like it's a bloody operation. It's actually very little blood loss, but you nick a capillary and those people things and they'll just bleed.
Yeah.
And you're always doing that. The capillaries generally just clot off and things when you're doing this, so they're not kind of a big issue. But no, primarily those that have some physiologically that isn't quite up to par, congestive heart failure, diabetes and things, if it's well controlled, you can do it. Nice thing about the head and neck region, it has so much good blood supply that healing even in those people are not as big of an issue that it would be in other places.
Is there anyone who is particularly a good candidate, or do you just need a forehead?
Kind of need a forehead.
You need a forehead, obviously.
Some people need, let's say they came in basically, there's a bunch of extra skin here and they want an upper blepharoplasty. You have to see actually where that skin comes from. Yes, we grow new skin there over time, it comes saggy and things, but if you push the eyebrow down a little bit, it automatically crowds that upper eyelid. So the lady that I did that day coronal on a couple of weeks ago, she's real satisfied with it. But her issue was, she had that crowding, but it wasn't from really extra skin, it was from her eyebrow being so low. So they'll come in thinking they need a particular operation when in fact they need another operation. Some of them need both.
Mm-hmm.
Some of them have the eyebrow down so low, and when you take it out, not all the extra skin went out, so you just take off that extra skin. So it's a combination. Everybody's individual, and that's where they should be treated.
Yeah, and you can help them figure out exactly what their issues are and what procedures are best for them.
Right. We'll get the little mirror out, they'll hold the mirror, and I'll show, listen, okay, you have more of a brow issue than you have an upper eyelid issue. And I'll lift this up, and all of a sudden their upper eyelids kind of clear out. They don't have that kind of overhanging skin. Sometimes you lift it up, they still have a little bit. So they say, the brow lift will get you most from it and things. If you want to take out extra skin, we can do a little skin, trim the skin. And really, doing the combination is not. I mean, it's fairly common. Doesn't increase your downtime. Really doesn't increase the amount of bruising.
What is the name of that the eyelid surgery?
It's called a blepharoplasty.
Blepharoplasty. Are there any other surgeries that you do in combination with the brow lift frequently?
The lower facelift.
Okay.
Yeah, I mean, generally if it's do a brow lift, probably, I guess 25% of them will have both of them together, and 75% will have them broken up. If they're more concerned about their neck, okay, then the lower, just the regular facelift and the neck lift is what they're interested in. Even though I really don't point out to people what they need. They tell me what they need. I think that's a reasonable way to go with it. And so most of them don't do it together. 25% of them will.
What percentage of men versus women do you see coming in asking about a brow lift?
About 10% men. Rest of it's women. And women, again, they'll age groups will vary. Men, like I say, it's more in the late 40s and 50s where they'll come in. In the 60s, they don't care about it anymore.
They don't care.
At least most of them don't.
Yeah. I will mention my mom did have a brow lift probably about 10 or 12 years ago. She was very happy with it. One of the things that she was dealing with was the sagging skin into her eyes. She said it was into her eyes so far that she had trouble even keeping her eyes wide open. It would almost like push her lids down.
It's heavy.
Heavy, so that she couldn't see. Do people say that after they have this surgery, that's one of the things that it helps them? I mean, she said it helped her actually see better. It was cosmetic, the reason why she had it, but it also helped medically because she could see better.
We can see better, and naturally what happens is people who need a brow lift typically will struggle, not consciously, to raise their eyebrows. That's why they have the deep lines there. It's all that energy going into contracting those muscles, and of course the skin over the top, becomes more plastic than elastic over time, and so it's like being in a credit card till you etch a line in it. And they'll come in, they'll have the brow lift and things, and again, it opens up the eyes. They can see better, but it takes care of that heaviness feeling that by the end of the day they're struggling to keep their eyes open. And again, it doesn't take much weight to make an upper eyelid feel heavy because the muscle that elevates it is so small, so small.
She also said one of the things that improved not just her eyesight, but after she had the procedure, she struggled from migraines, and she said she didn't think that would really have an impact on her migraine. She didn't even consider it beforehand, but she noticed after she had the procedure that her migraines stopped or were greatly reduced. She thinks it's because of the nerves that were cut when they did the procedure. Have you heard of that, or have you seen that?
Oh no, I've seen that. I've seen it for upper eyelids before, and the reason being is, migraine basically is in my opinion, it's a peripheral nerve issue. And in other words, kind of like carpal tunnel, there's an area on that nerve that supplies this portion of the side or this portion, or maybe even both, that gets compressed. That nerve has to kind of wrangle its way through like a little bony canal or a bony notch with a little tight fibrous band, and there's not much wiggle room for it. And so when you're doing upper blepharoplasties, when I'm reshaping things, sometimes I'll release that little fibrous band. But even without that, I've had people say, "Oh yeah, I did the upper eyelid, and I don't have migraines anymore." So it isn't, like I say, if it was inside your brain and things, you wouldn't have those comments. But with a brow lift, it's not uncommon. It's not uncommon.
We do have a caller at this point. Thomas has a question for Dr. Bridges. Thanks so much for calling, Thomas. What's your concern?
Yes, hello. Good morning. Good evening. I was just concerned, some of these procedures you're speaking of, the brow lift and the blepharoplasty, how long would those generally last? And I'll go hang up and let you answer.
Oh, you can listen. You didn't hear the question, did you?
No.
He wants to know, how long do the procedures last? The lift and the, I don't know how to say it, the blepharoplasty, the eyelid one.
Yeah, the eyelid one lasts very good. The forehead one, I think it's going to last you 10 years, 8 to 10 years. If you are diligent in using Botox and things to kind of keep the power of this muscle, because it's that muscle. It's the one that when you close or squint your eyes that pulls it down. I mean, gravity really doesn't have just a whole heck of a lot to do with it. And men tend to have heavier brows to begin with, so there is a little bit of weight, but they're heavy because they got so much muscle in there. But if it will last longer if they use the Botox. Now, I'm not trying to say, okay, we need to use Botox to make more money. It's basically if you can preserve that particular,
It's like maintenance.
Operation. It's maintenance, kind of like putting oil in a car. I mean, it's a simple thing to do, but you go through a lot of trouble, some downtime with the forehead lifts. It's not bad, but it's maintenance is probably your best way to do it.
So 5 to 10 years, you think, total, it would last you?
Longer if you did the Botox.
Okay.
I mean, you probably stretch it out to 10 to 15, but it has to do with the fact that our bodies give in to chronic low-grade forces over time, and gravity is a chronic low-grade force, but it's not very strong as far as pulling down an eyebrow. The muscles around your eyes are. And just keeping them, I like a little bit of movement in them because it looks normal. If you knock them out completely, I think it looks a little plastic. But if you just keep some of the strength down, it's going to preserve the results.
Does that answer your question, Thomas, or do you have another question?
Yes, thank you. Well, I don't want to put him on the spot. He, of course, I was wondering. You look good, doctor, for your age. I don't know what your age is, but to put you on the spot, I don't mean to. But have you had any procedures yourself? I mean, if you want to comment on that, I don't mean to embarrass you. But it might be an encouragement to other men as well. But thank you, and that's all my question. I'm sorry.
Thanks, Thomas.
I'm embarrassing you. Thank you.
Thanks for your call. I don't know if you want to share that on the spot, but that was his question.
What was the question?
You can't hear. You can't hear. You're not skirting around the question. He wanted to know if you take any of your own advice and have had any of these procedures yourself, or what you do for maintenance.
Yeah, around the eyes I'll use some Botox. Mm-hmm. Again, the reason is the only reason it gets down there is that chronic low-grade forces over time. I mean, there's plenty of studies that show that basically if you use Botox at a younger age and stuff, you prevent, number one, wrinkles, okay, and number two, some changes around the eyelids that make it look older. Now, in terms of his question for if men typically need both an upper eyelid surgery and a forehead, because they'll grow more skin as well as this brow coming down. So it's a combined issue. But let's say you had just the upper lid surgery and things. It lasts longer than a forehead lift. But typically, most men will need a combination of both.
We talked about some benefits that happen besides just looking better. Sometimes it can help migraines, could help you see better as well. Are there any risks or complications that people need to know about that go along with any type of surgery?
Well, I mean, there isn't much bleeding. The one thing they'll comment on, except for if you do the men, they never comment on having a numb scalp per se. But with the forehead lifts, where you do the coronal and things, they'll have a numb scalp for a while, like 6 months or longer.
How much does a procedure like this cost usually?
Somewhere in a range of $3,500 to $5,000, depending upon what they need.
And I'm assuming you probably have a payment plan for people who maybe aren't able to pay out of hand with that, or how does that usually work with people?
Generally, we use Care Credit. Okay, it's a very good program. Apparently, if you pay it off within a year, then basically there's no interest that's added on to it. So that's hard to find, And so that's what we don't have any in-house financing. We just basically have the Care Credit, and you can go online and find out how much you're approved for within 15 seconds or so.
Great. Well, we appreciate you being here, telling us about brow lifts, the benefits of them, talking with you about that today. Dr. Bridges from Bridges to Beauty. Thanks so much for being here.
Carly, I enjoyed it.
Appreciate it. Have a great day, everybody.